Let's take PCOS for example. What's the essential problem over here? A woman's got plenty of eggs in her ovaries, but she is not able to ovulate. The egg doesn't grow, doesn't come out of the ovary, and doesn't go in the fallopian tube. So, no pregnancy. They say that if you lose about 10% of your body weight, so let's say a woman is 80 kilos, if she comes down to 70, 72 kilos, she is likely to resume ovulation on her own.
So how do you actually define family?
Whatever an individual or a couple are happy with, that's a family. We are there to assist, we are there to guide you on your journey. In Pluro, we believe that you are the decision maker, you are the driver. We are there just to be with you and to guide you along the right path.
Welcome back to the Pluro Podcast, where we openly talk about the science of fertility, IVF, and starting a family. We often hear that infertility is on the rise and there are multiple factors that are affecting it. Joining me is Dr. Parikshit Tank, who is the co-founder of Pluro Fertility and IVF. So we were talking about women infertility. Now there are multiple factors that, as a woman, I understand might affect my fertility, which is say PCOS, PCOD, endometriosis, thyroid. So if you can touch upon each of them and, how can a woman kind of combat it or, work around these conditions to then be able to conceive?
Wow. So, Drashti, each of these topics that you mentioned, PCOS, endometriosis, now each of these is like a one-day seminar, right? I mean, and we are doing a 20-minute podcast.
Yes.
So, I think you said the right thing by saying that we'll just touch upon it. So, let's take PCOS for example, right? What's the essential problem over here? From the fertility point of view, the essential problem is an ovulation. A woman's got plenty of eggs in her ovaries, but she is not able to ovulate. The egg doesn't grow, doesn't come out of the ovary, and doesn't go in the fallopian tube. So, no pregnancy. What can be done for PCOS? Well, here again, we've got to go back to lifestyle because PCOS goes hand in hand with a higher weight range. And what we believe is that the higher weight leads to something called insulin resistance. Now you might wonder, like, why is doctor going into this whole diabetes stream? Where did insulin come in?
Yeah.
But actually it is central.
Okay.
It's an important integral part of how women ovulate. We think about insulin for blood sugar.
Correct.
Diabetics, insulin. But actually, insulin and insulin resistance plays a very important role in how women ovulate also. So when weight is high, the body tends to become insulin resistant. That means more and more insulin is needed to keep the blood sugar steady. This large amount of insulin which is there in the circulation changes the way egg making happens in the ovary. So for a number of women who have this problem, egg making just shuts down. There's no egg making. What can you do about it? Very simple for me to say, but extremely difficult for women to achieve, and that's weight loss. How do you achieve weight loss? Diet, exercise. And this common sense advice, right? Everybody knows what to do. It's the doing which is difficult. And doing it consistently to keep the weight down after achieving a weight loss is probably even more difficult. Scientifically speaking, how much weight loss do you need? So they say that if you lose about 10% of your body weight, so let's say a woman is 80 kilos. If she comes down to 70, 72 kilos, she is likely to resume ovulation on her own. Doesn't need to do anything else, no medical treatments, nothing. Once she starts ovulating, then from a fertility perspective, the PCOS will kind of solve itself because there's no other problem going on usually in these women. So a sustained effort at weight loss does give great results for women. Even if they don't conceive, why the weight loss, they are in much better shape to carry a pregnancy. So it's a big win over there if they can go on this journey in the best possible condition that their body can be. So lifestyle management is very important in women who are affected by PCOS. It plays a big role. If the lifestyle changes, how long to wait? I mean, how long should women wait before they say that, okay, I've lost weight or I've not lost weight and I just get on with it. I've tried everything. Usually we wait for around 3 months to see, how effective are those changes. Has weight loss journey started? I mean, somebody was 80 kilos. Have they at least come down to say 77, 78 by the time 3 months have passed? If yes, great. You're on the right path. Keep going.
And if no?
But if no, then we can either look at some medications. We use Metformin. And now, of course, there's the whole jing-bang of GLP-1s, Munjaro and so on and so forth.
So they can be used to treat PCOS and PCOD as well?
Not exactly treat, but they do help with weight management. Now, the tricky part about GLP-1 drugs is that we don't know how to optimally use them in PCOS women. In the sense, what should be the right dose? How much time should we give for the weight loss to happen? What happens if they become pregnant while they're taking GLP-1 drugs? These are a lot of unanswered questions that we have at the moment. So definitely this is not the first line of treatment that one would recommend. But this is something that can be looked at. There's a lot of research which is happening and interesting India-centric data will probably emerge in the next couple of years on the use of these drugs in PCOS women. So that's a space that, is red hot right now, and we are looking at it very keenly. So if weight loss by whatever means does the trick, that's great. If not, then you commence the fertility journey with some basic treatment, like inducing the ovaries to make eggs by giving medications, oral medications like letrozole or clomiphene citrate. If that doesn't work, then you go on to injections, and usually we team that up with a procedure called IUI or intrauterine insemination. And then if all that does not work, then IVF is an option which can be explored for PCOS women. Mind you, I'm talking about PCOS only from the fertility standpoint. There's a lot more to PCOS. There are different symptoms, different presentations which PCOS can have. I'm not going into all those aspects about PCOS. I'm just limiting our discussion today to the fertility aspect. If we look at endometriosis, what exactly is this? This is a situation where cells which line the uterus on the inner surface, they start growing anywhere. So if they start growing in the pelvis, outside the uterus, that's what you call endometriosis. Another condition which often goes hand in hand with this is adenomyosis, where these cells start growing inside the muscle of the uterus, not in the inner lining, but in the muscle of the uterus. So both these are now becoming fairly frequent in terms of reasons why women find it difficult to become pregnant. Endometriosis affects fertility because it can just change the way the organs are placed with each other, because it causes adhesions. That means the tube may get stuck to the back of the uterus. The ovary may get stuck to the side wall of the pelvis. And just the structural change is enough to, render a woman not able to conceive. It affects also the environment in which the pregnancy is supposed to get implanted. So it affects implantation. Sometimes it affects ovulation because there can be something called an endometrioma. That means a collection of this endometriosis material in one or both the ovaries. So there are a number of ways in which endometriosis can affect fertility.
But is there a particular reason why it happens to a woman, or it's just
Endometriosis, incidentally, is called the disease of theories. So everybody has a theory as to how endometriosis happens, but we don't really know exactly how. Why? Well, there are certain predisposing factors. I mean, if one is overweight, if there are certain abnormalities in the uterus, uh, if there's a genetic predisposition, that makes a woman more likely to have endometriosis, but it doesn't necessarily cause it. So, why is a difficult question when you talk about endometriosis. What to do? That's the next thing.
Yes.
So, if it's something what we term as mild endometriosis, then we treat it more or less along the same lines as unexplained infertility. But if it is a significant degree of endometriosis, most women will need surgery first. They'll need to get rid of as much endometriosis as possible from the pelvis and then embark on fertility treatments.
How does thyroid affect a woman's fertility, and what can we do apart from the thyroid medication that we already know or take care of? Apart from that, what can we do?
So, in terms of thyroid disturbances, the most direct impact which it would have is on ovulation, means the way the egg gets generated. Both extremes, I mean, hypothyroidism and hyperthyroidism, both can affect ovulation. And therefore, this is something which is like an easy fruit to pick. It's easily correctable. Can we correct it without medications? Probably no. I mean, sometimes weight loss helps, but most of the times women will have to take a thyroid supplement or something to correct that situation. It's a small tablet which needs to be taken on an empty stomach every day in the morning. And that sets the thyroid status right. It's also important to correct the thyroid status because it has implications in pregnancy. The child's development, especially the development of the nervous system of the child, depends on the thyroid hormone being in the right quantity in the mom. So we need to correct this before the woman undertakes pregnancy or even starts her fertility journey.
Okay, so all of these things like PCOS or endometriosis or thyroid, what I understand so far is affected largely because if we don't have a balanced lifestyle, if we have certain habits that kind of hinder all of this. And of course, then there are some unexplained reasons as to why something happens. And that's what I wanted to kind of touch upon next, is that something called as unexplained infertility. There's no particular reason that we're able to narrow down to that why is she not able to conceive. And how do we navigate about it? Like, what are the percentage of people who might go through this, and how do we then come around with a solution to this?
Right. So, unexplained infertility means there must be some reason why this couple is not getting pregnant, but we can't find it. So, what are the things which would go into making us define that, okay, this couple, you can say that they have unexplained infertility? The basics. I mean, if, say, the semen analysis is normal, the woman is ovulating regularly, she's got a reasonably good ovarian reserve, hormonal parameters are fine, the uterus is normal in structure, and both the tubes have been tested and they've been found to be open. If all these things are there and they've been having regular intercourse and yet they are not getting pregnant, then this is the group which is termed to have unexplained infertility. Now, let's imagine there's a group of 100 couples who comes to my clinic. I do all these routine tests. Out of this 100, there'll be 15 couples who will have all normal results, but not getting pregnant. So it's a bit frustrating. But the other way of looking at it is that, okay, there's nothing grossly wrong. So there's a good chance that you'll succeed sometimes on your own or sometimes with some treatment. So that's what unexplained infertility is. Often, and totally disproportionate amount of time and energy and effort and expenses are spent on finding reasons. But if you go through this basic workup and if you've not found anything, then doing more and more exotic tests is not going to lead you anywhere. The fertility journey should start at some point rather than trying to discover some research-based tests and things like that.
Right. So, for example, what happens is that many a times couples easily conceive the first child. But when it comes to probably they want to expand their family and want to have a second child, they're not able to do so.
God bless them, the couples who want to have a second child.
So, what is secondary infertility then?
Precisely what you asked me.
Yeah.
So, sometimes why this happens is just a function of age, right? Somebody's had their first child when they were 30. And they probably decided that, okay, one is good enough for us. But by the time they are 35, 37, they decide, no, actually the first one needs company and we want another one. So here it's very clear cut. It's just a function of age, and because age has increased, time has gone by, fertility drops. That's the reason. Very common. This is a very common situation. Then, of course, there are all the other factors which could have been responsible for primary infertility. That means a couple not conceiving in the first instance. So all those can still come into play at some point.
Again.
Yes, in a secondary infertility situation also. The treatment paradigm follows more or less the same cues. I mean, you start evaluation, go through the process of a basic fertility workup, then induce ovulation, offer IUIs, IVF. I mean, as the case may be. I would just like to point out that there are certain couples who've conceived with IVF the first time around. They become pregnant the next time without anything. Happens. I mean, very common scenario. Yeah, nature at the end of the day. And taking the cue from a previous topic, unexplained infertility, we've seen this happening every now and then. It does happen. Something just clicks into place after one pregnancy has happened. Please don't ask me what's the scientific basis behind this. This is just an observation. It's a clinical anecdote. We don't really know why this happens. Sometimes people say that we were stress-free and, that worked for us. Or
linking it back to lifestyle.
We don't know why that happens, but every now and then there'll be a couple who will do that and surprise us.
Yeah.
So that's what the second round is all about. And as I said, God bless those couples who want a second round. Hooray!
To each their own.
Yeah, absolutely.
So, like you mentioned, that secondary infertility can happen, cannot happen, depends on various factors. But in today's day and age, like with all the advances that have happened, etc., how do you actually define family? And if you do, what are the different ways of looking at it in a modern parlance?
Well, I don't know whether you've seen the show Modern Family.
Yes, I have.
And I'm sure there are lots of fans of Modern Family out there. So I think when we say family in today's world, it can be a family of one. A couple is also a family. So it's a very nebulous concept. Whatever an individual or a couple are happy with, that's a family. How does that family grow? That's up to that individual and that's up to that couple to take a call. We are there to assist. We are there to guide you on your journey. In Pluro, we believe that you are the decision maker. You are the driver. We are there just to be with you and to guide you along the right path.
Amazing. So that brings me to the end of this podcast. Thank you, Dr. Parikshit, for explaining us everything in a much more human manner, which we can easily understand and absorb. And yes, stay tuned to the Pluro Podcast.
Thank you, Darshni.
Well, it was an extremely insightful session. I'm sure all of us have learned a bit more about the science of infertility. A big thank you to Dr. Parikshit for being here with us, and I will see you all in the next podcast.